Dr. J, and I'd like to chat with you about sports medicine at the Danto Osteopathic Clinic. Osteopathy and sports medicine go hand in hand because the musculoskeletal treatment and body, mind, and spirit focus of osteopathy is a foundational component of a holistic approach to sports medicine. The same could be said for family practice because as part of osteopathic primary care, we recognize that every patient is an athlete whose performance we must optimize. My personal interest in sports medicine started in medical school, but my focus in practice has never been exclusively on athletes. Yet I've had the opportunity to practice on athletes of every age and skill level. My love of sports started in high school because back then playing basketball brought balance to my life. When on the court, I found that it was an orderly world that had rhythm and flow similar to music. When I branched out into tennis, I found the same thing. I understood at a nuanced level that sports required an optimized body and play was in many ways a spiritual experience. You pay and you play. I had my fair share of sprained ankles, concussions, and other injuries, and in the tradition of the wounded healer, my experiences provided insight and motivation to help athletes who suffered injuries similar to my own. Consequently, I feel a deep sympathetic connection to each athlete I treat. I will briefly talk about a few illustrative cases. I had a young man who was a freshman on the high school cross-country team who developed back pains. His tailbone had a dysfunctional twist, and his hip flexor muscles were tight in a way that turned off his gluteus maximus muscle neurologically. If left untreated, we've all seen people who, as they age, have disappearing buttock muscles and can't seem to keep their pants up because their belly becomes larger than the curves of their buttock region. Anyway, a bit of OMT and an exercise prescription relieved his back pains and moved him from the back of the pack to the front. The power from the kick at the end of a cross-country run is generated from the gluteus muscles, which was turned off before we intervened. Last, I will chat about one of my competitive cheerleading patients. She was a flyer, which means she was the one who was tossed in the air to flip around. She had been caught incorrectly and was inadvertently kneed in the back of her head and neck. This resulted in head and neck pain as well as intermittent dizziness. A dash of OMT and she was all better. These are just a couple of examples, and I can't chat about every ankle sprain, tennis elbow, or pulled hamstring. I've seen seniors that were bodybuilders, and when I say seniors, I mean older people. They're bodybuilders. I've seen yoga teachers, professional musicians, swimmers, runners, and weekend warriors of every age. At Danto Osteopathic Clinic, we normalize and optimize our athletes of every age and performance level to thrive in body, mind, and spirit. Thanks for tuning in. Ciao.